this COVID-19, it doesn't matter if you're in a B2B industry, B2C industry, or B2H industry, which is business to humans, we can all agree that health is becoming the new wealth. So everybody agree that this COVID-19 is a great opportunity for all of us to keep ourselves more healthy, even when we're stuck at home with not any chance that we can go out. So there's our two big trends that we can see in the digital world that are actually booming during this COVID-19. The first one of them is the rise of wearable technologies. The main value in the health world is that we can monitor every day what we're doing, and we can give database services to our customers. But for us, for marketeers, it can help us start a new regime of data-driven marketing for better experience and deeper and closer relationship with our users. And it doesn't matter if you're B2B, B2C, if you're addressing the end customers, the partnership, you will get much more data on your customers via the wearables that they have. Today, especially in the American market, we can see that we have Alexas, we have drones, we have headbands, we have everything that can actually connect us to the customers. And the good news is it doesn't matter what their age is, they're quite used of using them. So we can see the wearable as a great excuse or a great chance for us to have a closer relationship with our customers or the customers of our customers if we're in the B2B industry. And we see that the future of health devices is just growing. So we have the artificial intelligence, of course, but we have biometrics and drones and robotics, which are much more beyond apps. You don't need to do anything about it, but you at least need to know about it and think in everything that you develop from a digital perspective, even if it's your website, that you have a connectivity to those devices, because that will give you a lot of opportunities in the near future. The second trend that I hope that the majority of you who didn't thought about one step ahead of digital is telemedicine. And I think that the telemedicine or the teledigital services, not just in health, are actually the new future of each and every one of us. I think that everyone experienced telemedicine during the COVID-19. I don't know about you, but I have 3 girls, and one of them had like a problem in her leg. And I actually had a conversation via Skype with my physician, with my children's physician, to make sure that everything okay. So I gave him the picture, I sent him pictures via WhatsApp, and then he raises with Skype in front of me, looking at the leg of my children, and then sending me a subscription for her. Which I sent to the pharmacy and got it during delivery to my house. So I didn't need to do anything, but I did got a telemedicine service. People are much more open to this. It gives us accessibility and affordability to our customers. It's very affordable for high value health services that cost a lot of money for a pre-checkup and not just, you know, having like a very cost, maybe not effective meeting with a doctor. And for marketeers, we can have new strategic on retention and engagement, having a deeper and closer relationship with our users. And you can see in this poll that I found in the World Health Organization that people are very, very keen on telemedicine. They're open to it. They are understanding that the situation is changing. They understand that it will save them and the doctor or the service provider a lot of help, and they are seeing that it gives them a lot of value getting those services, and they're actually looking for them. So what can we do for that? The first thing that you need to do if you want to start a telemedicine service or start working with Wearable is understand that, first of all, it's an internal journey before it's an external journey. A lot of people, especially internal people, need to understand that they need to change their behavior. If it's nurses, if it's operation people, if it's the customer support, they need to understand that they need to increase the visibility and the awareness of the telehealth. They need to drive internal support for the program, making sure that all the dots in the customer journey are covered, that each and every person know their position within the telehealth. You need to drive utilization of the new services by patients and offering providers. And of course, you need to work about growing the reputation through media coverage, testimonials, and success stories, which is the regular, I'm calling it, marketing strategy. So first of all, work internally on the project and then externally. So internal marketing before starting promoting it to your customers. And actually, you can start doing it tomorrow morning. It doesn't have to have like a sophisticated infrastructure for that. I think that you can find and understand the beta human inbound technologies, even doing a Zoom meeting. I'm calling it Zoom customer support or social customer support. Is a great way for telehealth. Make sure that everything is connected to the devices. Most people have Alexas, Apple Health watches that with a very, very small IPI that you can actually connect all your services to them. And you need to start an action-based response. What does it mean? You need to track the customer behavior. So if you have a journey, try to find between 5 and 6 points that you can actually track within your telemedicine or your connectivity with the devices, and then actually do an analysis on it and start measuring it. And make sure that each activity will be rewarded. I'll give you an example. If someone is connected to your WhatsApp, okay, and asking for a question in the WhatsApp and want to have a telemedicine meeting with, I don't know, whatever, a physician, then you need to send an email or a WhatsApp message that say, thank you very much. We really appreciate your reaching out to us. We will reach out for you for a Zoom meeting between the hour, da, 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 da. Then someone will understand that there is someone else on the other side. This is a rewarding activity. Which people are actually expect when they have close relationship, right? If you have a close relationship with someone and you're sending him a WhatsApp, you actually expect him to answer quite fast, not even if someone is with a long distance with you. So make sure that you track those activities and give a fast response, and you will get a better relationship with whomever you wanna address. Make sure that you focus on the main messages of those telemedicine and devices activities. We need to focus on convenience, lower cost, time and money saving, video and goal tracking via screen sharing, specialized care, long-term success, or or support from home. We're using those tactics, those marketing tactics, to make sure that we have a closer engagement and closer relationship with our customers, to make sure that there will be a smaller churn from our services. And of course, measurement is key. I had a manager that said that what is not measured is actually not managed. So you need to decide what are the key points that you're measuring. This is very important for the internal discussion that you have and the external discussion to see if you're succeeding in those activities. I gave you just an example of the World Health Organization, what kind of key points that they actually monitored on their telehealth services and their digital services. But if we found that we have 5 retail journey points that we have with our customers, make sure that you measures them and make sure that you are improving on a daily basis. So you actually need to track them every single day to know if you're actually growing and you're improving your services. Something very important, action items, because I have only 15 minutes. Olga is with a stopper with me. So I wanted to give you some action items, but I know that in the next webinar, we're going to go much deeper on measurement and digital and how you do it to create better engagement, authentic and relationship with our customer.
In the workshop.
In the workshop, just remember that the future is of health is in wearable and in telehealth. You can actually start doing it tomorrow. Our customers are very open to this during COVID-19. They're actually expecting it. So they expect video chat. They expect WhatsApp connection. So if you're not using it, you know, you're missing a great opportunity. You can actually start tomorrow with an internal discussion, an internal journey with the stockholders. Map your customer journey and see how you can integrate behavior-based marketing via telehealth or devices. Start small. You don't need to start big. You don't need to have a massive technological infrastructure. WhatsApp is also an option, and keep messaging relevant to the channel with a message that tell the customer what is the benefit that they get from it, and build your new engagement and retention measurement metrics to make sure that you're improving every day. This was just the tip of the iceberg in 15 minutes. And I really, really hope that I can share more with you, because this is like the coolest, most exciting topic ever for a digital marketeer. That's it. Any questions?
So I don't see questions so far. We had a question from, we have a very interesting point from Ruben, who wants to start, who is a practitioner in chiropractic and functional medicine, and he's thinking to start telefunctional medicine practice aimed at US and UK. So Ruben, I think this is a very interesting case study, and Shira is the expert for this.
I have to say that this is great, because before you come into chiropractor or whatever, you probably have a lot of questions that you can get a lot of value from that. And if you have some tactics or exercises, that will be great. You will create great engagement with your customers, and I can guarantee that first you will get much more customer in a shorter time, and they will be willing to pay more for your services, for your hands-on services, if they are going to get benefit from the telemedicine services. So you are going to create deeper engagement, better retention, and high value from this customer, because it's much easier to grow a customer, a current customer, than bring a new one. So I think that it's a very, very good initiative, and good luck.
And Ruben says, sounds wonderful, hands-on in Israel only, I am all ears. Okay. Perfect.
So my presentation is for you. It's open. I will send it to Olga. Olga, you can share it with um, everyone that participate, or on your website channel or whatever. This is for you. It's a gift for you on this COVID-19 area.
Perfect. Thank you, Shira. So it will be uploaded to the YouTube channel. So please do register, because people are always asking me, when will I get the recording? So once you register to the channel, you will get the notification automatically once all the new videos are uploaded. Thank you, Shira, for the wonderful presentation. I think people can really learn a lot from you. Shira is one of our speakers also in the workshop. She will be leading the digital health and direct to consumer session, where she has tons of